Law of Protection Part 2, number 1596, April 13, 2026. Gerald C. EclaireMD Foundation, category stroke, cardiovascular disease, CKD, dementia, cancer. Personal reflection. When Newton described motion using a simple mathematical relationship, he did not attempt to describe every detail of nature. Instead, he provided a structure that helped humans understand interactions among forces. Similarly, the law of protection does not attempt to fully model the complexity of human pathophysiology. Its purpose is very practical. Through the law of protection, TSI value provides a simple structure that helps people detect early signs of instability before major medical events occur. Chronic diseases often develop silently over many years before symptoms appear. Early awareness may provide an opportunity for earlier lifestyle adjustment, improved metabolic control, and reduced long-term risk. Simplicity often reflects deeper understanding. The law of protection is intended as a practical warning tool to support prevention-oriented thinking within biomedical systems. Epilogue. This paper does not introduce new mathematics beyond the multiple TSI-relate papers I have written during the past 40 days. The primary new contribution is the naming concept, law of protection. Simplicity is reflected not only in the equation structure, but also in the naming of the concept. The term TSI may appear technical or abstract to many people. In contrast, the phrase law of protection is intuitive and easy to understand. Protection of what? Protection of health, protection from stroke, cardiovascular disease, dementia, chronic kidney disease, and certain cancers closely related to long-term metabolic disorders. A simple name improves structural understanding. Clear understanding improves communication with patients. Effective communication improves practical usefulness. Direct usefulness saves lives. Another key finding from working on this paper is the real-life demonstration of the productivity of No.1596 collaboration. This morning, the idea of the law of protection emerged. I then reviewed my prior papers to retrieve the TSI equation structures and amplifier definitions. Using verbal audio interaction, I explained my idea and structural concepts to check. The AI converted my spoken language into a semi-completed written document. I then reviewed, refined, and inserted additional observations. I also incorporated this morning's biomedical measurements together with the 90-day moving average curves from July 1, 2025, the day after discharge from Stanford Hospital, through April 13, 2026. I then generated the data table and 90-day moving average figure using my customized medical AI system, Chronic, on my iPhone. The 90-day moving average curves clearly show progressive stabilization and the recent convergence between the TSI2 and TSI3B curves, indicating improving balance between vascular mechanical stress and metabolic condition. After verbally describing these observations, he attached the generated data table and curve figure to the commercial AI system. Chat. The AI assisted in identifying precise details that were not numerically specified during my audio interaction. For example, I described glucose as being below 100 mg DL, and the AI identified the specific value of approximately 90 for mg DL. This illustrates effective collaboration. Natural intelligence contributes idea generation, conceptual structure, detailed creativity, and editorial refinement of the chat-generated content under the naming concept of the law of protection. My personal customized medical AI system, developed over more than 20 years, performs data processing, mathematical computation, and graphical visualization. Commercial AI chat assists in language organization, structural clarity, and integration of narrative with figures. Another practical benefit is correcting typos created by my aging eyes, which recently underwent cataract surgery. This is also the main reason I recently prefer using the audio function of chat instead of typing on the small screen of an iPhone. Through this No.1596 collaborative workflow, a complete research paper integrating equation, interpretation, and graphical evidence was produced efficiently. The total development time was approximately 3 hours. Previously, similar papers often required approximately 10 hours. The reduced time requirement occurred because approximately 95% of the core ideas were already developed and validated in my prior work. The primary new elements in this paper are the simplified naming structure law of protection, regenerated data table and figure, and the continued validation of the No.1596 collaboration methodology. This experience demonstrates that combining human creativity with AI-assisted computation and communication can significantly improve research productivity while maintaining conceptual clarity. and structural rigor, without compromising the quality of my research work. Disclaimer: I write this paper not for fame, but to share what I have learned so others can better understand their health, prevent disease, and live longer, healthier lives. This content is for educational reference only and does not constitute medical advice. Doctor-patient relationship is created. You may share this summary freely, but it must not be altered, edited, or republished as your own. All intellectual property rights belong to Gerald C. This content is provided for educational reference only and does not constitute medical advice. No doctor-patient relationship is created. You may share this summary freely, but it must not be altered, edited, or republished as your own. All intellectual property rights and copyrights for this article and its related materials belong to the author, Gerald C.